Emmanuel, for those strong words and messages. It's an excellent opening for our day today. And we, Alexandra, are very much privileged to stand in front of you today to present the very new report of financial health of Europeans. The effort has been joined, so we are joined here to present the results, and I will start, and then I will continue. You will continue with the final recommendations. Okay. So, are we ready? It's a professional privilege to be standing in front of you today, and I'm very excited, not only for the occasion, but because we at EFPA truly believe that there is something important for us to do together in the coming months and years. So I defined two goals for my today's presentation. First, I want to build your appetite to read the whole report, because there is everything in there. And perhaps even more importantly, I have the goal to encourage you to join the European community of professionals who strongly believe that financial health should be high on our agenda. Okay, so let me have it. We are celebrating the 25th anniversary of EFPA. And for some time, we've been trying to find meaningful ways to communicate the role of financial advisors as contributors for our customers. So we asked ourselves the fundamental question of why. That is, what financial services, financial institutions, and people in financial institutions are for. And there are, of course, many perspectives. One would say we are to sell products. Some say we are to distribute products, and some of the financial institutions call themselves distributors. Personally, I dislike this language, and as a client, I wouldn't like to deal with a distributor. People say we service clients, and it's fair enough, but does it come up to our aspirations? So let's move to the demand side and say that we provide, using financial services, what people need. Or, being more progressive, we deliver or offer, provide value to customers. That's good enough. But then the question comes, what does the value stand for? Okay? So today, with the results of the report, we recommend and propose that the value is financial health of people. And with this perspective, we are moving from financial inclusion, which is mostly about offering the supply side, to financial health, which is the value creation for customers. So, with those thoughts in mind, we embarked on our new project. But we knew that we are not doing it in a vacuum. So we decided to do our homework. And we did the desktop research to see where globally we stand in terms of the concept of financial health. We didn't want to reinvent the wheel. And what we saw in the desktop research results. It is clear now that financial health has been gaining recognition as a measure of the ultimate goal and outcome for individuals in terms of the value out of financial services, right? So when you read the documents of the leading global organizations, starting with UN, OECD, G20, BIS, you see financial health in their strategic documentation, in the research results, with a strong call for stakeholders' engagement and call for action. We can read that financial health should be the measure of success, not only in financial literacy, which should move beyond knowledge and move into efforts to build new behaviors of how we take care of our personal finance. It is strongly emphasized that financial institutions have unique opportunity and responsibility to make financial health an element of people's lives. So with this bigger context, we embarked on our research. And going into the first results, I want to start with the message from our lead researcher, Katarzyna Sekścińska, who, having written the final report, said achieving financial health should be one of the priority for every person. Actually, I could stop here, but there is more. But we can say easier said than done. So very often in EFPA, we think that what gets measured gets improved. So we really wanted to add to the overall picture with the very first step to see where we stand in terms of financial health in Europe. So we embarked on the research in the financial health of European. It was a joint effort and excellent cooperation with Better Finance. The research was, this is the result. The research was performed since April to July this year in 9 countries, and in Poland it was delivered last year. So perhaps let's have the first specific result of the research, but before that, let's see who participated. We had 10 countries, a good distribution, geographic distribution in Europe. Over 14,000 people participated, so a very representative sample. Some of you can find your numbers on the list, and throughout the report, all the results you can see distributed by the countries participating and also by women and men. Going into the research, we decided that analyzing financial health, we are going to go into some specific areas. So we wanted to get answers on financial stability and financial situation of households, the sense of financial security, planning and achieving financial goals. This is an area very close to EFPA heart. Self-assessed financial knowledge, of course, liabilities, financial safeguards, that is what kind of financial controls people use, and then attitudes about money, that is how we feel about money, what emotions money evokes in us. Working on the final report, we really were determined to offer valuable insights to a wide range of recipients of the report. So starting from public institutions and regulators, financial institutions, of course, financial advisors working with the clients, educators and trainers, psychologists, and of course, last but not least, the consumers. It was very important for us at the start of the research to define what we mean by financial health. We also try to use simple sort of human language for it. So here it goes. We define financial health as a state in which you feel you are in control of your finance monthly, annually. You are able to cope with unexpected bigger expenses, so you have a financial buffer. You meet your financial goal according to the plan, and it's a major area. And you have financial freedom to make decisions that allow you to enjoy life. We have this perspective that money is not an office, it's not accounting, it's a tool to make us be able to live according to our values. And what is important to say, those 4 areas actually are found in all the different international approaches to how financial health is defined. So we are synergetic with what is there in terms of financial health. So with this definition, let's have it, the first concrete result of our research. Financial health of Europeans, self-evaluation 4.3. The scale is 1 to 7, where 1 is very bad and 7 is very good. From the methodological point of view, the result is neutral, which means not bad, not good. I'm an optimist, so typically I would say the glass is half full. But given the importance of financial health, I would argue the glass is half empty. And it shows how much is there to do. With this result, you also have the country distribution of the figure. And I should perhaps clarify that this figure comes out of asking the question, how would you rate the state of your financial health? And as you can see, we are, the highest is 4.61 for Poland. Optimistic nation, it seems, and 3.92 for Hungary. Quite critical. Okay. Now, with this overall evaluation, let's go deeper into the results in selected key areas of the research. So, the perception of financial health by Europeans. 86% say financial health is important. Only 15 feel financially free. 78% believe financial health is achievable. This is very optimistic. But 1/3 believe that it is achievable only for wealthy people. What is important is, and for some of us it was quite a surprise, a positive surprise, that 67% think that financial health is achievable not only for the wealthy people. So this shows the potential of what we can do together. But then I think we come with the result which is really very, very worrying. Less than half feel financially secure in Europe, which means that over 50% people in Europe do not feel secure. So let's call for action and let's work together. Financial knowledge and skills. Quick overview. We, talking Europeans, we evaluate our knowledge well in basic elements, in basic areas. It's by far worse if we go into more sophisticated, complex elements of knowledge, starting from investment. I would like also to observe that still I think we do not differentiate between knowledge and skills, and it makes a huge difference, and it's a very relevant topic for financial education, because you can imagine it's a completely different story to know how to ride a bike and to ride the bike, right? And that's the difference between knowledge and skills. But the good news from this area is that there is really a high appetite to learn. So we have people open to learn and grow in this area. Then we have income and expenditure awareness, and this is an interesting one. We know very little, and we can not precisely define how much we earn. Yeah, more or less, and it's very more less than more. We are slightly better in terms how much we spend, but still there is plenty to do in this area. Because it's an important area. When you don't know where you're going, you will not get anywhere. So we went deeper into this area and we created a financial control index, and the average score in Europe is 8.6. The index is composed of 15 elements, which means 15 different tools to control your finances. So the 8.6 means that out of possible 15, on average, a citizen of Europe uses 8.6 tools. So this is an area for improvement. Debt and savings. Emmanuel mentioned it, of course. We, yesterday night, were talking about the Europeans being good savers. Still, from the report, it's clear that there is improvement possible in savings also, especially if we talk long-term savings. But just few numbers, 36 hold liabilities. What is, I think, relevant, 49 faced repayment issues. And 15% have no savings at all, right? And if we say predominantly, we save for short-term goals, not the long-term goals. Then investment and retirement. And we also talked about the challenges related to demographics and retirement resources for people. And it's really striking, again, that 44% of Europeans do not know the value of their pension contribution, right? And even worse, 32% do not do anything for retirement, and even more, they won't. And you know, when I read this result, I thought it looks like a lost population. Yeah. So there is really some alarming signals here. And for investment, we have here saving accounts and term deposits and passive cash holding. So in this group, we know that it's not really investment. If we go into investment as we understand it, the picture is really, really glooming. Then financial planning and goal pursuit. And this is, again, this idea of if you know where you're going, you can get there, right? So in Europe, the picture is the following. We declare that we are good in planning and even long-term planning. But then if you say, okay, so let's have a check it, then what we have, 15% only persist consequently with delivering on the plan. So we plan, but we do not deliver. And I think this area actually, which is one of the core out of 4 core areas for financial health, is a major area of improvement. It's a major area for strong practical financial literacy interventions, and it's a important area for financial advisors and their support to clients, because we should be sending the message to the customers that financial health is like getting fit. No one is going to do it for you. This is the bad news. The good news is that you are not alone, or you can choose not to be alone, and you can go to your trusted advisor for help. And finally, the last area is attitudes towards money, emotion, culture, and behavior. If you try not to read the slide, and I ask you, which 3 words connotate with you when you think money? What comes into your mind? Anyone? Independence, good one. Anyone? Wealth? So it was surprising to us to some extent that what we find here is 75% associate it with security, which is sort of intuitive, right? But then comes freedom, which connotates with independence. 90% money, I simplify, equals freedom. And then 81 say it brings happiness. Yeah. And I think this shows the need and the importance of using new language when we talk about money. Then feelings about money, strong emotions, both good and bad, right? Interesting and relevant one. 50% say that money causes household arguments. So if we improve in this area, we really go into improving well-being of people, right? And then money is really the fundamental to meet our physical basic needs. But what is important, and it relates to financial health, it connects very much to our psychological health, to our social position, and to our self-actualization. So now, in brief, the key findings of our research. Financial health is very important to Europeans, though for many it feels out of reach. There is a strong connection between financial health, psychological health, and social well-being. Financial security is the foundation for financial health. More than 50% of Europeans do not feel financially secure today. We have limited financial control and budgeting practices, major gaps in financial planning and goal pursuit, but high motivation to learn. So this is in a capsule the key findings of our research. And before I give it over to Alexandra for final recommendations coming from our report, I would like to share with you a piece of work in progress that we've been doing as EFPA, and we will continue. We were a little bit hesitant whether to show it because it is work in progress, but it's very relevant in terms of our declaration that we measure to improve. So I'm proud to present to you the very fresh and new prototype financial health perception index for Europe. And it is the working name of it, Financial Health Beat 3.6, as the representation of how we perceive our financial health in Europe. And just a few words of explanation. First, a prototype index, a perception index as a benchmark for other measures, And it is a composite index composed of 10 elements. And those 10 elements came as the most influential elements in our research. So those elements really translated in the final evaluation of financial health. And here you have the distribution around Poland. And what we could see is that the financial health beat index is closer together among different countries than the first result that was the answer of just one question. And it showed to us that we are moving in the right direction and that that index can be more representative of the perception of how we feel about financial health in Europe. So, Emmanuel, all the colleagues from EFPA, I understand that we can declare we will continue our work to measure, to improve. And now I give it over to Alexandra for final recommendations coming out of our research. Alexandra, please.
So the recommendations, and I think after the introduction of Mariola, nobody expects it's going to be mostly about financial education, because we think there is much more to improve financial health of EU citizens than just financial education and literacy. So as Mariola already said, financial education and skills to get to financial health are two different things. The best would be they go in parallel and that people have both a very good financial literacy and financial knowledge and the skills, but for the time being, it is not the case. So we really think that what should be done and where should more attention of EU citizens go should be budgeting, saving, financial planning, and also some tools and realistic scenarios that they can build, ideally with a good quality advice that they get from the advisors. Then encourage awareness and planning habits. This is definitely an area when we still have to improve in the EU. And there are good ideas, for example, also from EIOPA when it comes especially to retirement, how to help citizens with that. Because as we saw from the research results, only a small proportion of citizens are able to say what is their income. But what I found even more concerning, this was not mentioned by Mariola, that unfortunately many of the EU citizens quite grossly exaggerate and overestimate their pensions in the future. And some even believe that they are going to be higher than their current salaries. So this gives you the extent to which we really have a problem in the EU. And this also comes with the huge pension gap that we have already. So facilitate debt management. We would like to see more tools and guidance for responsible borrowing and for some early interventions. And there are also some good ideas how to go about that. And what Mariola already mentioned, and this is extremely important, really to support more this goal-driven behavior. And this we see as a very important role also for financial advisors. So we would like to see more help for individuals to get good quality advice to help them go into the direction of their long-term goal. We saw also some concerning results as to how many people really have long-term goals when it comes to their financial health and how many really consistently pursue them. And this is quite concerning because we know that also from the Better Finance report on the real returns of pension savings, that many people nowadays are invested in products that not really bring them good value for money. And unfortunately, also many of them do not realize that. As we have seen, many do not realize what is even their financial contribution towards their pension. And also too many say they don't do anything about the pensions and they won't do anything about their pensions. And this brings us to the next recommendation, and this is about addressing emotional triggers. So Mariola also mentioned that money evokes strong emotions. What I found quite surprisingly, Swedes were among the ones where actually those emotions were extremely strong when it comes to money. And for example, in Better Finance opinion, one of the good ways of helping citizens to address those emotional triggers and not to go and divert from their financial plan would be, for example, to have more auto-enrollment in the EU when it comes to pensions, to keep and help the citizens to stay on the track towards their retirement. And yeah, then tailor advice and to cultural and gender needs. So we saw some differences when it comes to results for different countries. And most likely it also comes from different cultural contexts, but not only of the citizens, also of the financial advisors. And we also know from different research studies that not in every country financial advisors sees advising for retirement as their main goal. We learned that, for example, in the UK, most of the advisors sees advising for the retirement as one of the main objectives. It looks completely different. I think it was something about 70% of advisors. It looks completely different in countries like Italy, when only 17% of the advisors consider this is the main area where they should actually advise citizens. Sort of no-brainer, of course, technology, it helps a lot to help people with financial planning and going on to the financial health. There is often the topic of gamification then comes in, and it can be useful, but there are also some caveats that should be taken into account when we talk about gamification in terms of improving financial wealth of citizens. And last but definitely not least, so this is really actually the most important recommendations from Better Finance side, pairing education with trusted advice. Better Finance has been saying over decades that being a financial consumer and an investor is not a full-time job. Many people not only have the financial skills to do it, but they also don't have the financial literacy to do it yet. And therefore, in our opinion, what would be one of the most important goals for the EU, it would be to really ensure access to very good quality advice to citizens, because this is exponentially also improving their chances of achieving at some point financial health and wealth. And as I said already, we really see the critical role of financial advice on this journey to achieving financial wealth. And across different countries in the survey, people still very clearly say that they do rely on financial advice and financial advisors. And we think it would be really very important to deepen this research, because I mean, the main core of the research the project that we have done with EFPA this time was actually, the survey was very much focused and concentrated on the topics of financial health. But based on the results that we have seen, we think it would really be very valuable to deepen the research into financial advice and to also understand why, for example, in some countries of the EU, people rather go to their friends and relatives to look for recommendations when it comes to financial decisions, while in some other countries, quite many of citizens go to the advisors. By the way, I was very interested when I was waiting for the results of the study to see if the situation changed from 2018, when the Commission study was published, and where it was pretty clear that predominantly EU citizens, when they at some point consider they should get financial advice, they go mostly to their financial bank advisors. And most of them also at that point in time were not aware about some possible conflicts of interest were going. Then most of them assumed that the advice that they are getting was for free. This has not changed much. So still many people, when they go to financial advisors, go to their banks. And again, it would be really interested also to understand their reasoning. We did not ask those questions in the current survey and project, but I think it will be very important to do that in the future and not too far away future. So we will have still 2 panels and debate to discuss the role of financial advice. But as I said before, we think that one of the most important critical components of a good strategy of the EU to improve the health of the citizens would be to improve the quality of financial advice and access to it in the EU. Thank you.
I have the mic. I have the mic. Okay. So with the words of Alexandra, you can see, yeah, Alexandra, please stay with me. What an excellent partner EFPA has for the report. We hope you felt the energy and the enthusiasm that we have. And it's not only because I think we can say we are proud of what we've achieved so far, but we are exciting about the importance of the way forward, right? So to conclude, I think we need to thank the key contributors to the report, starting from Katarzyna Sekścińska, who is possibly watching us online. And we hope to continue the cooperation. Our sincere thanks to Emmanuel Carluccio. Can you pronounce the name properly?
Sebastian Comin, our Policy and Research Officer at Better Finance.
Okay. Aleksandra Mączyńska, Weronika Lakatos, and last but not least, all the participating members and countries and the respondents to the questionnaire. And if you allow me, two final words and messages. One message I would like actually to send to our members, that is financial advisors. Go and talk to your clients about financial health. Tell them that they can improve their financial health every day. Two messages. The bad one is that they have to engage and they have to do it themselves. The good news is they are not alone. They can rely on your professional support. And to went back to the beginning, we strongly believe in the community of certified financial advisors and in collaboration with Better Finance, that financial health is our common good in the European society. So let's work together to improve it. Thank you.